So coming to the second question, what is the most common symptom of acute abdomen? Very good. The most common symptoms of acute abdomen is abdominal pain. It's very important to know the underlying pathophysiology of abdominal pain. Unlike pain in the extremities, the abdominal pain can be relatively more difficult to differentiate what is the cause of it. We have this visceral pain sensation, parietal pain sensation, referred pain, spreading pain, and shifting pain. We have to understand that the abdomen has dual sensory nerve supply, namely visceral and parietal. Visceral sensation, visceral pain is because of distension, inflammation, or even ischemia of the hollow viscus. And it's normally slow in onset, dull, poorly localized, can be protracted. It's diffuse, deep-seated pain. Yeah, sometimes can happen in the can be felt in the epigastrium, which could be because of the pain that arises from the foregut. Periumbilical, which can arise from the midgut, and the lower abdominal pain could be arising from the hindgut. So it is usually in the midline because it has bilateral sensory supply from the spinal cord. Whereas for parietal pain sensation, it is sharper, it is acute, and precisely localized. And is due to the direct peritoneal irritations such as pus, bile, urine, leak GI contents into the peritoneal cavity and irritates the peritoneum, cause inflammations. It is better localized because it is supplied by the somatic fibers from one side of the nervous system. And there is this referred pain. Referred pain is because of the pain at the different sites from the noxious stimulus due to confluence of different afferent nerve fibers to the posterior horn of the spinal cord. For example, biliary pain, which is from the a visceral organ, is being referred to the right scapula because of the nerve supply at the somatic nerve supply of the right scapular area. So also the subdiaphragmatic pain referred to the right shoulder. For example, subdiaphragmatic irritations by air or collections being referred to the right shoulder by the phrenic nerve. And there is this spreading pain or the shifting pain. The site of pain at onset is different from the site of pain at the presentation. So, for example, the acute appendicitis, the pain is at the periumbilical or sometimes in the epigastrium because of the visceral pain from the distended appendix shifted to the right iliac fossa, which is sharper in nature, the pain, because of the parietal peritoneum inflammations. And for the spreading pain, it's also in the case of perforated peptic ulcers, the sudden pain in the epigastrium slowly spread in the right iliac fossa because of the leak gastric content that tracks down into the right paracolic gutter. The mode of onset of pain and progression is also important, plus the systemic signs. It's very important for us to take note of this. If the pain is sudden onset, severe generalized abdominal pain, it could be due to perforated viscus, ruptured abdominal aortic aneurysm, ruptured ectopic pregnancy. Systemic signs accompany these conditions, serious conditions. Could be tachycardia because of the pain, or because of the sepsis, or because of the weight loss, because of the blood loss. Tachypnea, sweating, or patient in shock. Now, abdominal pain with a prior history of prior amenorrhea, vaginal bleed, of course, we should entertain the differential diagnosis of ectopic pregnancy. Whereas mild, steady pain becoming more intense, centered in a well-defined area over a couple of hours, could be because of acute cholecystitis, acute pancreatitis, or strangulated bowel, mesenteric infarct, or renal or ureteric colic, or bowel obstruction.